Hey guys, it's Dr. Nico from Precision of Movement. So today we're going to be talking about knee pain, more specific patellar tendonitis, or what they call jumper's knee in regards to playing basketball. So today we have Andrew here, he's going to help us out. So a lot of times what can happen with having knee pain, especially in this patellar tendon region, is due to a lot of things. Maybe it could be due to immobility or lack of flexibility. It could be due to lack of strength, maybe in the quads, maybe in the glutes, and it could be also due to maybe poor mechanics, jumping, landing, cutting, or anything like that. And we'll get into that as we go down the line. So today we're actually going to be talking about the flexibility phase and how it can help relieve some tension in the quads, in the patellar tendon, and help you get back into the sport that you like. Okay, so today what we're going to do is show him. So let's say, for example, Andrew has some left patellar tendon pain. So he's been playing basketball for like maybe an hour or two, and he's getting a lot of soreness, and he's having that recurring every week maybe. So this tendon right here, right underneath the kneecap, is where that patellar tendon is at. So when he's maybe overusing some muscles like his quads, it can put a lot of tension and strain to that patellar tendon that's attaching to the kneecap. So to help relieve some tension, I'm going to show him some stretches and some ways to mobilize the quads to offload that patellar tendon a little bit, okay? So what we're going to do, maybe what you can have is a foam roller or maybe like a lacrosse ball or anything like that. We're going to kind of help massage that area, soft tissue mobilization, to increase the flexibility. So Andrew, let's have you go down. So he's going to put the foam roller right on his quad, and he's going to kind of roll in and out of it. So just with this, you want to go maybe up for a minute. Maybe go like 3 rounds. The point of this is to find any tender spots or stiffness in the muscles and try to roll it out with a foam roller. Once that happens, you'll increase some blood circulation, the muscles will feel a little bit more pliable, and it won't feel so stiff and pull on the patellar tendon. Perfect. So let's take that out. So let's say he's done that for 3 sets of a minute. Now maybe we'll talk about how he can stretch that muscle a little bit more. So let's move this part away. Let's have you go onto your stomach, Andrew. So the point of, let's have you face this way a little bit more. Angle this way. This way. Yeah. So let's talk about proper muscle flexibility. So essentially what you want with this quad flexibility is to get yourself on your stomach, and if you can touch your heel to your buttock, like so, that's considered normal range of motion and good muscle flexibility in the quad. So say, for example, if Andrew here is having a lot of patellar tendon pain and his quad is really stiff, maybe he's not even getting towards that his heel to the buttock, excuse me. So what we can do is slowly increase some of the flexibility. So what you can do, Andrew, is grab your heel if you can, and he's just going to pull all the way to the buttock. Obviously, if it's too painful, you can back off, but if it's tolerable, you can hold on to it. Good. So same thing with the foam rolling. You can kind of hold it there for up to a minute. Let's say it's really sensitive and the minute feels really, really painful. Let's have you go back into it, Andrew. He can kind of pulse in and out of it just to give some room to breathe for that quad. So back and forth, back and forth. So same thing, if you do like 3 sets of a minute, try to do that. And then to retest to see if your flexibility is getting better and better, you can have someone like a physical therapist or a movement expert check your flexibility again. So let's see this. So if he can reach his heel to his buttock, that means his flexibility is getting better, and his quad tendon is, patellar tendon is probably not pulling as much. All right, let's have you stand up or sit up. So we talked about flexibility. We talked about quad mobility and how it can reduce some of the pressure on the patellar tendon. The next video will be talking about muscles that we need to strengthen and how we can actually get back into it so you're not hurting your patellar tendon again. Thanks, guys.